thank all of you who are joining us on Facebook, YouTube, or any social media. We really thank you for, again, being a part of our weekly virtual town hall meeting. We have been doing this now for 8 months, and we got a great panel tonight. I do want to give everyone that's on our social media. That number is 857-799-9641. And with that, I just want to introduce the panel tonight. We got a great panel tonight. We're going to have a great discussion because I know for a fact that we're starting to see on the news, we're starting to hear that these numbers are going up. And we want to make sure that here in the city of East Orange and really throughout that we continue to stay focused and we continue to stay vigilant in terms of this pandemic. So with that, I just want to introduce our panel tonight. And we have Amaya Laudo, Health Officer from Essex County. We also have with us Dr. Griffin, who has been with us for the last 8 months. She's our health director. And myself, I'm Mayor Ted Green. So with that, what we want to do, we want to just give some numbers out tonight, but we constantly have to ask everyone, if you're on our lines, we're asking you to mute your telephone so everybody can really get the information. Tonight's conversation is going to be around really this pandemic and this COVID-19. And as we close out, we'll give you some updates of some of the things that are going on in the city and around the city. And also we're going to talk about some things and how to stay safe during the holidays that's coming up, because it's going to be so important for all of us to make sure that we stay safe. So with that, I'm going to ask Dr. Griffin to give out the numbers for tonight, as we always have been doing. But I do want everyone to really add where these numbers are at, because each week, if you notice and you have been keeping up with the numbers,
Over the past several weeks, you've heard me talk a little bit about the numbers and the stability, relative stability in our numbers, where there were slight increases from week to week, day to day. But tonight we're reporting new information related to the pandemic, as well as the number of cases here within the city. Within East Orange, currently we have a total number of 2,197 positive cases. There has been a last week, to the extent that the numbers of new cases have actually tripled since last month. And that's significant because, as the mayor mentioned, we're seeing an increase, a significant increase over the last few days and also across the span of a month in our number of new COVID-19 cases, positive cases. As far as the deaths are concerned, the COVID-related deaths, that has remained stable. We haven't received reports of new COVID-related deaths within the city. As far as the ward breakdown is concerned, within the first ward, there are 364 positive cases. Within the second ward, there are 420 positive cases. Within the third ward, there are a total of 506 positive cases. Within the fourth ward, there's a total of 496 positive cases. And when you look at Essex County remains the highest. That you do pay attention to what we are sharing, and you make sure that you're doing everything that you can to continue to protect yourselves and also your loved ones.
Thank you, Dr. Griffin. Listen, as Dr. Griffin said, we came too far. I know we can do it. We gotta stay. So with that, this brings me right into the segue to not only thank our guest tonight, Maya. We thank you so much for being with us. And I know you have been on this COVID pandemic because I'm on a call with you every Tuesday at 9:30 with our county executive and Phil Elijah, and you're always on that call. So Maya, if you
I want to say thank you to our county executive. As you said before, Joe DiVincenzo. We're all together and in this together since the beginning of last
year. Yes.
boots on the ground and help from any state resources that they do have.
Right. If you can, what are some of the patterns and trends being observed among the new positive COVID-19 cases throughout the county? And is there a specific age group that appears to be testing positive at this fast rate?
So the age group, I'll start with that first. We at first were concerned about our vulnerable populations or long-term care facilities. As time went on, schools began to open, sports began to open, we started seeing larger numbers in our younger populations, 18 to 34.
Right.
Gatherings within households is really where we're seeing a lot of our trends. We are having a large uptick in infection rates within the community when an individual attends large gatherings such as a party. An approach, especially for our vulnerable populations and our elderly, we need to, yes, we want to go ahead and spend our time and our holidays with them, but we really need to sit down, reevaluate how we are going to go ahead and spend our holidays.
Right, and that is great. Is there any information that can be shared regarding the severity of the new cases within the county and have the COVID-19 related hospital in the county? Have we saw an increase in people going to the hospital?
We've seen a slight increase in the in people going to the hospital. Hospitalizations, we have not. We also are seeing, when we're doing some contact tracing, we are seeing the difference in symptoms. When we were doing contact tracing in the summer months, we are seeing a lot of asymptomatic individuals. Right now, we're seeing large numbers of symptomatic individuals, those that do have symptoms. We're not sure if that's due for maybe a slight combination of the flu. We're not sure of that, but we are definitely seeing a lot more symptoms.
Right. So, we started, well, not starting, for a few months now, a lot of the parks are now open. And a lot of residents, I know we get calls each and every day of the activities in the parks, right? Should people start being concerned about the activities in the parks or the activities that people are moving around, trying fitness and trying to stay healthy? Is that a big concern, or are we all right? And that's on the county level, because we all fits into that umbrella with the parks.
I think staying healthy is number one.
Yes.
Staying outside, there's nothing wrong with going to the park. But again, looking at those larger gatherings with more than 10 individuals and having close contact with them. We need to go ahead taking a walk with your mask and socially distancing in the park. In order to keep ourselves healthy, we all know that physical fitness is connected to our mental health, and that is important, especially during times like this. But remembering socially distancing, face masking, and ensuring that you are not participating in activities, even outside, that are in large numbers or large groups.
Right. And listen, we are constantly beating that drum each and every day about the mask, about social distance, about washing your hands for 20 seconds. So when it comes to, we quite often hear it during our governor's weekly, daily meetings. We hear it through the county. We're starting to hear it on different levels. How is the county, quote unquote, preparing for this second wave of this pandemic? What is the preparation in terms of getting ready for it?
I started out by saying communication.
Okay.
We need to make sure that all of our municipalities were in constant communication. We're a tight-knit community here of 22 municipalities that all have to work together. We all need to understand that as we go on to this second surge, we do have our county OEMs that that are preparing with stockpiles of PPE. We are going forward and we are continuing our testing. The county executive announced Tuesday on our call that we will continue to test, free testing for everyone who is an Essex County resident until the month of April. We offer 4 days a week. We offer free testing in 4 different locations. COVID.org. That is all of our county websites, all of our county test sites. We offer both nasal and saliva at these sites. All you have to do, register, make an appointment, and show up at your appointed time, and you can go ahead and get a free test.
And this give me an opportunity, and thank you for that, because we are pushing the same idea in terms of the testing. We think that we need to go back in the community and have people get tested again, because we've been moving around. But this is a question for both of you, for Dr. Griffin and for you, Maya, right? What do you feel that the uptick is, right? What do you feel that we are doing to elevate the uptick in terms of these numbers going? Community.
At least what we're seeing locally is that there are a lot of individuals who are becoming very complacent and very comfortable and tired of wearing masks, or tired of following the guidelines, or they're not following them as closely as they did originally. So as I mentioned, and we were talking about, there are more indoor gatherings, the weather's changing outside, the season is changing, so we're seeing individuals move from the outdoors and move indoors. And when they're inside, they're a little more comfortable and lack coverings or even washing their hands and even remaining distant from one another. And so that is something that's definitely contributing to the increase. And then, you know, if individuals are becoming ill, there's also a level of comfort that we're seeing and hearing about as far as severity or the perceived severity of COVID. But it's so important to note that whether or not we're seeing an increase in hospitalizations or seeing an increase in the rate of individuals who have passed away or are passing away due to COVID, the reality is there's still other complications associated with COVID. We still know of a lot of individuals who have lost their sense of taste and smell. And they've lost that for an extended period of time, or they're individuals who have experienced other complications even if they are no longer hospitalized or have never been hospitalized. So it's still very important to make sure that you're protecting yourselves whether or not you come in contact with the virus or in the event that you do come in contact with the virus. And if I'm and we were advised that the county is actually offering testing here in East Orange on October 22nd and October 23rd. And that's going to be at 50 South Clinton Street. So it's important to, you know, share that with the community, especially based on what was just discussed as far as the county offering saliva testing and nasal swab testing. So that's another option that our residents have to get tested.
Right. Mara, give me your perspective on, you know, why you think there's an uptick in what some of the things that we should be doing and we can do in terms of this COVID.
I think a lot of us have relaxed our and become complacent, as
Yes.
Dr. Griffith had said.
Yes.
I also think one of the things that is truly it's been a combat for all of us is the amount of information that's coming out.
Mm-hmm.
We have media outlets, we have social media, we have so many different ways that we're getting information. I think at some point people just don't know which way to go and they just kind of say, okay, you know what? I don't know which way to go. My recommendation there is listen to your local health departments, listen to your local public health officials. With that being said, I think one of the biggest reasons that this uptick is occurring is because we are not listening to the quarantine and isolation guidelines that are being given to those individuals who are coming in direct contact with positive COVID individuals. The 14-day quarantine period should be followed until the 14th positive COVID-19 individual stay quarantined in their homes for that 14 until that 14 days has ended. Secondly, those individuals who have tested positive need to ensure that they're being isolated and isolating themselves both from their family and their communities for a total of 10 days. I think that is one of the things that I cannot stress enough is taking the direction of the public health officials when they're given to you.
Great, and thank you for that. And I do agree with both of you that we can't get lax. We can't allow ourselves to go backwards. You know, I posted something this morning on social media. I said, listen, we came too far to go backwards, you know, and we all been working together trying to get this thing right. And we got, you know, to continue to just stay focused. Listen, we know how hard it is putting on a mask every day. We know how hard it is to try to practice the social distance. But with that, and both of y'all can answer this question, you know, most of the time, I think the perception out there is that since we are outdoors and there's circulation that's outdoors, you know, we're in the air, I think sometimes folks have a tendency of thinking that, okay, I'm outside, there's ventilation, I don't have to wear my mask, or I'm gonna put my mask on, but I'm only gonna wear Also, what advice can you give them not to have a perception because you're outside? Yes, the guidelines say we should be outside at restaurants, outdoor activities. What is the best advice that we can give folks to, you know, remind them you still can be near somebody who can give you, or you can attract COVID from that person? What is the best practice that we should be doing, even though we're outdoors? So either one of y'all can elaborate. We'll go with Maya first. Since I don't want you to tell Joe you didn't go first. So
I think face masking is one of those things that we need to take some personal accountability for.
Yes.
I think personal accountability when it comes to face masking. We need to understand that the reason that we are wearing that face mask is to protect other individuals within our community, not just ourselves. Why do we have a face mask on? In order to stop droplet spread. If you have a mask on that's covering your face, you're decreasing the amount of individuals, the amount of droplets that are being put on surfaces and also being aerosolized. With that said, if you have a mask on, you're stopping that from anyone you come in contact with. And also wearing the mask when you are in contact with someone, maybe they have some droplet spread, will protect you as well.
Right. Dr. Griffin?
And that can occur whether you're indoors or outdoors. So there's nothing that we've seen thus far to suggest that you are 100% safe when you are outdoors. And so it's important to still wear a face mask, whether you're indoors or you're outdoors, because you don't know what you may in fact come in contact with. And so the reason why the regulations have shifted and there was the promotion or is the promotion of outdoor dining is because it might be safer due to a degree of air circulation, but it's not 100% safe. So you still need to, as was mentioned, make sure that you're covering your face and you are doing everything that you can, even if you're the only one walking down the street, because again, you don't know what has been in the environment prior to you getting there.
Well, yeah, listen, we've been constantly beating that drum also. We ain't gonna stop beating the drum. Our young people, right? Our young people, because, we're gonna constantly have a conversation about our young people. Like I said, the parks are open, but we gotta our young people understanding the importance of them also. We want them to have some physical fitness, basketball, or they're jogging, or they at the skating park to keep on those masks. Just reiterate that again.
Sure. What we've seen is that, and what we know is that there are a lot of adolescents and younger adults or younger individuals who seem to have a sense of invincibility, as though nothing can harm them. And whether or not they contract it to a severe extent or experience a severe level of symptoms, they can still take the virus back to their loved ones who may not be or have as strong of a system as they do. They might have a compromised system and it can put them in a different position as far as the illness is concerned. So it's still very important whether or not our young people are out in the community, because as was mentioned before, it's not just about you. It's about everybody else that you can come in contact with. And there's an accountability. Because without that, it's not about what one individual does or, no one can have just that mindset that, they're doing this for themselves or choosing not to do this for themselves. What you do or do not do can impact the larger community as a whole.
Right. Maya?
I think first off, let's give some credit to our young individuals. This is a first-time experience for anyone or any parent. Let's give a hand to the parents that are going and dealing with this.
Yes.
It's a brand new experience. I think when it comes to exposure, wearing masks, understanding how COVID spreads, I think we as number one public health officials, also people that our children look up to, we need to practice what we're preaching. We need to be the example. We need to wear the face coverings properly. If we cannot say to our young people, you know, if you're a teacher or if you are in some influential, any influential position, and you are not practicing what you're preaching and you're not doing what should be done, I think that's what we need to do. We need to take accountability for ourselves, teach our young individuals accountability, and understand that they're learning just as much as we are.
Right, and Mari, thank you. That those who are just joining us, I just want to again say welcome to our weekly virtual town hall meeting. We have on our panel tonight Maya Laudo from Essex County Health Officer. We also have our very own Dr. Griffin from the City of East Orange Health Office. So again, I just wanted to say who we have on our panel tonight, and we thank all of you for joining in. In tonight's discussion, we're talking about the COVID-19, which we have been talking about for the last 8 to 9 months. But tonight we wanted to have another conversation because we know that all of you have been watching the news, and you've been watching some of the language and some of the information that has been provided to all of us about when you look around different states and different cities, the numbers are going up. And our goal tonight is to ask all of you who have been doing so good to help us by continue to stay focused and continue to practice social distance, continue to mask, continue to encourage your family, your friends, your neighbors, even the community to continue to just keep holding on. We're going to get past this, but we got to do it together. So with that, I want to talk about again the COVID testing, right? And both of you can put your perspectives on this, right? I took the COVID test twice already, right? Because I'm out and around people. How often, from both of your experiences, should an individual take the COVID test, and under what circumstances that they should take it? You know, a person may be out. A person may, we know if they travel and come back, it's a must. But why should they take it more and more? And now, if they do take the COVID test and they don't take it again, some people feel that, you know what, I don't have to take it again. If I'm around somebody and I don't have it, I don't have it. Let's kind of, what should people be doing in terms of taking the COVID test, and how many times they should or shouldn't be taking it?
We have been, my first test site was March 26th, and I will not forget, that day will forever live with me. First of all, let's all start to understand that the COVID testing that we have right now, the PCR testing that we're offering at our sites, is a point in time test, which means if you test negative or you test positive, that is in that point in time. If you test right now, it is 6:37 on October 21st, 2002, that is your positivity result. It does not mean that that is your result tomorrow, October 22nd, 2002 at 12 p.m. That's very important for us to understand. When should you get tested? You should get tested if you engage in a high-risk activity, being involved in a large gathering, or maybe traveling into a state that has that is on the quarantine list, for example, or even going and just traveling in general, going into a high-risk situation. When it comes to general testing or vulnerability, if you are in a vulnerable, when you are in a vulnerable population, whether you're compromised, or you may be elderly, or may have a type of diabetes or whatever it may be, maybe testing when you're coming in contact again with a large group. You maybe went to the store more often than you would normally go. I think one of the things we need to understand is we need to understand how COVID spreads and what we've done in order to perhaps put ourselves in the position where we may have gotten it. And I think understanding that and educating ourselves into how it spreads, how we can get it, how to stop it, and if we did not practice that social distancing, we did not wear that mask, maybe it's time to take advantage of that test.
Right.
and I would echo everything that was said in addition to when you exhibit symptoms, right? We're going into the flu season and there are a lot of individuals who are becoming a little concerned or confused about what their symptoms may mean and if it's COVID related. And so there are individuals as well. If you're exhibiting symptoms, then you also have an opportunity to seek a test to confirm whether or not it is COVID or to rule out COVID as a concern.
Right, that is great. So listen, we've been going through this COVID for a long time, right? Is there any other advice? I mean, listen, we know those who are out listening to us on social media. You have some questions, you have some concerns. What I want to do before I even go back to my panel, I'm going to kind of look over there at Connie Jackson and see who's on our Facebook page who have some questions for the panel. So Connie, can you please give us those who are on Facebook that have a question?
Okay, we have a few, Mayor. This one I'll direct towards Ms. Lordo. This is from Howard Moore, and he'd like to know, is the testing at 55 South Clinton Street drive-through or walk-up?
It is 50 South Clinton. And also,
Good point.
just to point that out, and just to make sure, it is actually both. It is both drive up and walk up.
Okay, and so we mentioned, I know the flyer says that there's testing tomorrow, but there's also testing at that same location on Friday, 23rd?
Correct. So the saliva testing is being offered on October 22nd between 4 p.m. and 6 p.m. And the nasal swab testing is being offered on Friday, the 23rd, between 8:30 and 12:30. That last one is at Weequahic Park, whereas 50 South Clinton is just on Thursday, October 22nd.
Okay, and can one of you tell us the difference between the nasal and the saliva test? What's the difference?
Sure. We started out at the county sites offering the nasal swabs. Once we were able to get the saliva, we started doing it. So they're both the same type of tests. They're both a PCR, a molecular replication test of the DNA of the virus. The difference in the test is the way that it's administered. So the nasopharyngeal or the nasal swab that we're used to hearing is one that is administered by a clinical or clinician. We use registered nurses at our sites, and that is, it goes up to your nasal pharyngeal space. It's kind of like that spongy area, and the sample gets taken there. The saliva testing is more of a self-administered test. You receive a kit. It has a funnel on it. What you do is you are in our drive-through sites, you remain in your car. You then produce a saliva sample, and then you just go ahead and drop it off. So there's no clinical interaction in that sense. It's a self-administered test.
Okay, Kathleen Walker would like to know, if she's walking by herself and no one is around, does she still need to wear a mask?
You can take a break if you need to take a break, but the recommendation would still be that you fully wear your mask, because again, there could have been someone who was within that space shortly before you entered it. You don't know. And so it's better to err on the side of caution as opposed to just thinking that you're completely safe if you're walking independently.
Okay. And Mildred Johnson would like to know, is East Orange in the red zone like New York?
When you look at the number of cases, our numbers are increasing. As far as the red zone, I don't know that I would characterize it as a red zone, but it is, when you look at the state, our numbers are increasing across the state. And what happens across the state is something that impacts the county. What also happens in local jurisdictions, whether it's in East Orange or neighboring municipalities, can then also impact East Orange. And so I think rather than characterize it as a red zone or a hot spot as far as the entire city is concerned, I think that it's important to really pay attention to what's happening across the state and understand that, again, what happens within the state, what happens in the county and other jurisdictions can also happen here. So yes, this information has to be taken seriously, because it could be, within a short span of time that we're also impacted in the same way. that New York has been impacted.
That's all we have related to
Wow,
COVID right
okay,
now.
no, that's, listen, that is good. I mean, and I'm glad somebody did ask, about the hot spots, right? Because, you know, we've been talking about hot spots also. Yeah, when people talk about hot spots, right, is there a certain number of COVID, people that has to kind of like, it has to be a certain number to say it's a hot spot? Mara, how do they consider hot spots?
I'm gonna use the clinical definition of what an outbreak is.
Okay, there you go. Yeah, they need to, yeah, you're right.
The clinical definition of an outbreak is two individuals who are not direct contacts of each other have gotten it in the same space, which means if I have gotten COVID, Dr. Griffith has gotten COVID, we did not directly contact each other, and we came into the same space, we would then be considered an outbreak. But if me and you were in the same space and are considered direct contacts of each other, that is not considered an outbreak.
Wow.
So we need to understand that the reason why it's called an outbreak is because there's two cases that are slightly unrelated are then in the same space. That is something we need to understand what an outbreak is. And why does that occur? Because there's other outside factors that are affecting this particular community or that particular community that is causing that infection rate to go up.
Wow, that's something wrong, okay. I didn't even know that.
I
So,
did get another question.
yeah, so we do have another question, Ms. Jackson?
Yeah, specifically about how long the virus droplets last in the air.
I've heard varying, we've had this virus for 7 months. We do not have enough clinical data, we do not have enough scientific data. There's been a variation, we've heard everything from 2 hours to 19 hours or 18 hours, whatever it may be. I think what we need to understand is droplets are produced, droplets contain the virus, and we need to be vigilant and understand that the virus is contained in it.
Okay, so with that, how do we distinguish, you know, it's flu season, and a person having symptoms in terms of, you know, coughing, chills, just feeling real bad. How do they distinguish it from being either COVID and the flu? And we've been talking about this for the last 2 weeks, so both of y'all can kind of dive into that question.
Dr. Griffith, I think some of the particular symptoms, such as the loss of taste and smell, doesn't really relate to the flu that much. I also think what we can, and some of the symptoms are very similar, and sometimes we're not going to be able to distinguish without doing one thing, getting tested. Also, when you go ahead and get tested for COVID, probably if you're at your healthcare provider, go ahead and get tested for the flu at the same time. Also, get your flu vaccine. It's the flu vaccine has been promoted by healthcare, public health officials for a long, long time, and you hear us saying it all the time, and now is really the time to get it.
In addition, loss of taste and smell is something that's also unique to COVID and not necessarily associated as consistently with the flu. But there are many other symptoms that resemble one another, whether it's the flu symptoms or COVID symptoms. And so that's why it's important. We know that there is a vaccine that exists, a proven vaccine that exists for the flu. And so it's important to get the flu shot and do whatever you can to control something that you know and using something that has been proven as opposed to leaving it up to chance to be able to distinguish between the flu and also symptoms of COVID.
Thank you for that. Can both of you give out your telephone number to your agencies and also your website where people can contact you?
Sure. I think for me, I'm going to just not clutter people with websites and phone numbers. Before, when I introduced myself, I did start here about a year ago with my position.
Okay.
So sometimes with all the craziness, I do not remember my full office
listen,
number. I apologize.
You fell right into this stuff, yeah.
But I will give one very, very important website, and that's essexcovid.org. That's where you can go ahead and get tested. You can get tested for free. We have four days a week we're testing. Go ahead and take advantage of it. Thank you to our county executive, our just county administration. Without them, we could never have done it. So thank you, and just go ahead and get tested on accesscovid.org.
Right, and thank you for that, Myra. And also, Dr. Griffin, can you give out your number also very quickly before I go back to Myra?
Absolutely. If it's about what's occurring locally, or you're having difficulty accessing county information, you can feel free to contact the Health Department at 973-266-5480. Also, it's very important, as much as we go out and we're monitoring what's occurring in the city, we need as many eyes as possible as well. So if there are concerns, if you're seeing something that's concerning you related to activity or behavior that could potentially promote the transmission of the virus, please also give us a call at 973-266-5480, and we'll do what we can to investigate.
And thank you for that, Doctor. Dr. Griffin, give the folks out there just an overview on some of the things that you offer at our health department, and how can people, get assistance.
Absolutely. As was mentioned in previous virtual town hall, medication-assisted treatment through our East Orange Substance Abuse Treatment Program. We also have the Division of Senior Services that has been doing an amazing job in providing support, not only for the seniors, but also the community at large, by distributing food. And they've been distributing food from about March or April, even as recently up to as recent as last weekend. And they will continue to do that and provide support for the community that way, as well as providing additional resources, reaching out to wellness checks. We also have a nursing division that is available to our residents as well, and currently our nursing division, in addition to providing general services, they're providing free flu shots to our community. So if you have questions about that, or you're interested in receiving a flu shot from our nursing division, you can feel free to call us. We also have an HIV counseling and testing program as well within the health department that is active, in addition to our dental program. Our childhood-led prevention program also exists and is up and running. We also have funding through our lead hazard control program and we're partnering with the county on that as well, to continue to abate lead in homes. And we know that there are a lot of individuals that are spending more time in their homes, and we offer a free consultation. And so if you have questions about it, if you're concerned about the potential for lead in your home and you have a child there, or there's a potential for a child to be within your apartment or your home, feel free to give us a call, and our department and staff within that program will answer any questions that you might have.
Thank you so much, Dr. Griffin. Myra, are there any assistance programs that the county is offering to those families who have been impacted by this pandemic?
Our county executive and our administration, the county, through the help of funding, through CARES funding, has established some rental assistance programming, small business assistance programming for those businesses that have been impacted by the virus. The county also holds a weekly food distribution every week. Usually it's on Thursdays at each one of our municipalities to assist those who have been impacted by COVID. I'm going to use the words of our county executive. This is not something that is going to go away. This is something that's here right now. We need to work together. We need to help each other. And any communication that we may get from your residents that maybe there's resources that we can provide, please let us know.
Thank you, Myra. And listen, we love using that word, working together, because I really want to commend especially the citizens here in the city of East Orange, but more so the entire staff who we all joined together and locked arms together from day one with this COVID. And I do want to just take time out to commend our drug abuse workers who, during this pandemic, I really didn't give them a lot of shout outs, but they really weathered the storm in terms of our substance abuse here in the city of East Orange with their staff. So I want to really just thank Yvonne Blake and her staff for a fine job that they have done during this pandemic and making sure that our population of folks who use that facility was still taken care of. So kudos to our drug abuse center. So with that, lot of questions, a lot of information was provided this evening. I'm so grateful that we can come back and have this discussion, even though we don't really, we want this thing to kind of wind down, but as folks constantly say, it's here right now, and we got to continue to make sure that all of us who are out here each and every day take care of ourselves, take care of our families, and don't give up. There's a lot of resources out here throughout the county that you can get resources. Please stay on the website. Please go on the Facebook page where if folks are stressing or we having anxiety, we have information on our website where you can get help. If it's a food distribution, as Myra spoke about earlier, we're working with the local churches. We're working with our county. We got our senior service building facility is giving away food and vegetables and fruits each and every day. Also on Wednesday, in the 3rd Ward, Bert Linnaeus and Vernon Pullins, who and myself have a food drive for those who cannot get out today on Wednesdays at 120 Rhode Island Avenue. You can come and pick up boxes of food. Thank our county executive. To, and Amara said early, we know y'all back in school, and many of you on virtual and remote learning. We here for you. We behind all of you, and to the parents, we behind you. If anything we can do to help, to assist, please reach out. We know the teachers are doing the best they can, the principals and our school district. So again, we all in this together. We all, if we need help, please reach out. We've been giving you telephone numbers for the past 7 months, 8 months. Please take advantage of those programs we have. You know, Myra just talked about the rental assistant. We also, here in the city of East Orange, just talked about the rental assistant last week with our very own Dan Jennings, who is the director of policy planning and development. That program is still it's open for those who need assistance in rental. We still have money left. Please go on our Facebook page, go on our social media, go on our page and get the number. Please take advantage of these programs if you need the help. With that, what I want to do before I close out, I'm going to ask Dr. Griffin, I'm going to ask Myra, Maya, who did such a great job and really giving us so much vital information. Do you have anything you want to close out with, or any advice, or, you know?
I think the simple advice is, let's all just take a minute, step back, be a good human being, and accept that we're not in something that we know exactly what to do, or maybe someone around us doesn't know what to do. But I think holding ourselves in an empathetic state, holding compassion for one another, and understanding that we may have different and varying views of what's going on, and accepting that.
Thank you. That was nice. Dr. Griffin?
I would just add that we know it's not easy. We don't know what the next few months hold, And so it's just important to not grow too weary or too tired with just maintaining the safety precaution. Prevention is key, and it's so important for us to do what we can to prevent the contraction and the transmission of this virus. And also, if you know of anyone who's been negatively impacted by COVID, has been displaced also by COVID and is in need of support, please don't hesitate to contact us. If they have no other means of gaining support, please contact the health department, and we will do what we can to link you or the individual to available resources.
Thank you so much, Dr. Griffin. I just want to close out, have a few announcements that I wanted to make, and to the community, to the residents. One is, again, we talked about the food distribution. Please take advantage of that. Again, I know that we still grab and go goodie bags. If you have any kids or any teenagers, everybody's welcome to the grab and go. There also would be a day of horror drive-in movie. We're trying to stay within the guidelines of keeping everybody safe, so we're going to do a drive-in movie where the families could come in your cars. You still have to wear your mask, you still have to make it underneath the costume, but it's going to be a good day, and that's going to be on October the 30th at 7 p.m. at the East Orange Campus High School. That's 344 Prospect Street. Please come on out. Please make sure you call 973-266-5151 so that way you can register for the tickets. But we want everybody to come out and be in a safe and healthy environment. Let's stay mindful of that. Also, the First Ward Council members, Councilman and Chair Chris James and Councilwoman Amy Lewis will be hosting a trunk or treat at Salvo Park on Saturday, October 31st from 1 p.m. to 3 p.m. It's going to be social distance. A pumpkin patch garden event at the Weiner Street Garden on Saturday. Again, safe and healthy, social distance. You must wear your mask, and that is going to be on October 31st between 10 a.m. and 3 p.m. All right? Limited space only. I'm going to say that again, limited space only. So if you're interested, please reach out to our planning department, and they would assist the limited space in terms of that event. Okay, let me see. Also, just very quickly, parking has been, we're reinforcing the parking. I know folks have been a little upset, but we have to make sure that we clean our streets. So please bear with us. We ask you to follow the rules and regulations of the signs. We ask you on certain days to park your car. If the signs say Tuesday and Thursday from 2 a.m. to 6 p.m., we're just asking everybody to follow the rules and regulations. Our streets, right? Also, don't forget about the National Prescription Drug Take Back Day over at our East Orange Police Headquarters. If you have prescriptions and they're old and you need to get rid of them, you can walk over to the police department. We have a box, a mailbox, where you can dump it in. Now you know that prescription is safe and it's out of the way from those who can be harmed from it. We're celebrating Fire Prevention Month this month, so take advantage of that also. Last but not least, make sure I'm not forgetting anything, kind of gave me a lot. Our recreation after school program and a safe and healthy, that's the Department of Recreation and Cultural Affairs has started its Smart After School program for students grade K5. It will be held right at our Fellowship Center. Please reach out 973-414-4141 for information. Boys and girls basketball clinic for grades 6th through 8th graders, right? Again, at our recreation department, in a safe environment, healthy environment with social distance. Or if you're interested in any of those programs, please reach out to the respective departments. If you need help from my department, and that's the Mayor's Office of Constituent Services, please call either Aja Baldwin or Justin Brown. And they can be reached at 973-266-5151. And with that, I just want to thank Maya. Thank you so much for being here with us and taking time out of your busy schedule, because I know how busy you are with these 22 municipalities. Dr. Griffin, we've been doing this thing for 7 to 8 weeks. I always put another month because it seemed like we've been doing it a long time. To those out there who joined us this evening, we thank you so much each and joining in for our weekly virtual COVID-19 meetings. Again, we're asking all of you to continue to stay steadfast, to continue to practice social distance, stay vigilant, and also wash those hands. We will tune back in next week, but if there's any information, we have been on this meeting virtually for the last few months. The information is provided on our Facebook page. Connie has been posting it. So with that, we're going to close out. I ask all of you to continue to work with each other, continue to help each other, continue to don't give up. We came too far. I'm going to say that again. We came too far. I'm going to say that we came too far. We got to continue to work together. We're going to get past this. As I always said from day one, that when we get over that finish line, we'll get over that finish line together, and we still in this together. So with that, don't forget to vote on November the 3rd. It's so important. Let's go East Orange. We can do this. So may God bless all of you. May God bless you, your families. May God bless East Orange. And we'll tune back in next week. Thank you for joining us this evening.